and I guess if anyone has questions that, we can bring them up to speed or they can ask.
You got it. Well, good afternoon, everybody. Angela Ombres and myself, my name is Travis Riker, are your advisors from the Arista Consulting Group team. We've got one other person that wasn't able to join us today due to a pre-scheduled commitment, and that's Karen Klopp on our team. Going to spend the next probably 30-ish minutes just kind of in terms of formal conversation, just going over the open enrollment process. I will promise you one thing: we are not going to go over every single page in this guide and read every single word on the page. We're going to try to make this a little bit more entertaining and engaging, informative to the best we can. I know this is our first opportunity to spend time with you all. So what I hope to do is to educate, entertain, and empower you to make better decisions, knowing that this is only something that you get to do, one time a year. But all of you were sent the benefits guide. But we're going to have a copy of that in the online enrollment system called Employee Navigator. That's what we're going to use today. So everything that we're going to do today is being recorded. So if you want to share this with a loved one, or you want to come back to this at some point in the future, or Nadia can use this for new hires, it's here for you to make sure it's a consistent message. But all of your benefits are staying as they are until May 1st. After a pretty thorough review process that spent a few months with the leadership team, we went through a pretty exhaustive process of negotiations with your current providers and other service providers to make sure you had the best deal. At the end of that process, we did make a decision with the leadership team's support and approval to not only stay with UHC ACEC, which is kind of a special product for engineering companies for your healthcare benefits, but to also expand all of the other lines with United Healthcare as well. In doing so, that saved cost for every individual kind of across the board, and put us in a better position than we were maybe to start with, for example, Guardian, that had some of your other benefits. But this is open enrollment. So what does that really mean? Open enrollment is the time that you can make any changes that you want. You can elect medical if you don't have it. You can deselect medical. You can move plans. You can select, dental and not vision, or whatever combination that it is that you make sense. Some of those benefits are employer paid, and so there's nothing to do in that regard. But we're going to get kind of through what the changes are and kind of a high-level overview of what the enrollment process is, because the enrollment process is the most significant change this year. It's the thing we want you to spend time with and clarity to make sure that all of your stuff, all of your elections are done online in a secure environment, so that we can then send that information to Nadia from the payroll deduction standpoint. And also that is the information that we send over to the insurance companies to make sure that ID cards and all of your dependents are in there correctly. So at the highest level, we know you are probably not going to absorb more than about 20% of what I say today. So it's being recorded, number one. And then number two, this guide allows you to kind of come back to this information when you need it most. I would tell you in general that our advocacy line, our employee benefit assistance line, and the information to our team is in this guide. It's better for you to engage us before it becomes a problem, because it allows us to advocate better on your behalf. But there are going to be times when problems happen, and you'll be able to reach out to our team to assist you with which plan is best for me. I'm having a claim problem, or something just doesn't sound right. Our team is available to you, and I'm going to show you where that contact information is. Just kind of at a high level, the company paid benefits, there's nothing for you to do. The basic life insurance, the long and short-term disability are all paid for you from the company, so no enrollment is necessary. There's nothing to do. You'll see those enrollment selections on the screen. You're just going to save and continue. There's nothing to do there. What you can do is make voluntary selections on the other benefits: medical, dental, vision, voluntary, or what's also called supplemental life, health savings account, and then your accident, cancer, and the other products with Allstate. Those are also remained unchanged. Some of this is just some technical information about who's eligible, when you become eligible for benefits, what's a dependent, what do we really need to do during open enrollment. And so essentially what open enrollment is, guys, and this is not an Arista or United Healthcare or an R2T rule. This is the IRS's rule. Because you're allowed to pre-tax your premiums for medical, dental, and vision, the IRS allows you an opportunity to make pre-tax contributions. And so what that means, you can make whatever changes you want during open enrollment. Once open enrollment ends, which is the end of the day Wednesday, and yes, we understand it's somewhat of a tight turnaround time due to some insurance company delays, you are not allowed to make any changes unless you have what's called a qualifying life event. You know, you get married, you have a new baby, you get divorced. Those are the only times that you're allowed to make those changes. And again, it's not an us thing, it's the IRS's rules on that. So just to kind of let you know what that is and what it sounds like, this next page kind of goes over what those qualified life event rules are. And then most importantly, the enrollment is through Employee Navigator. I know this is the second time. I'll probably mention it at least 5 others because it's important. The most important thing for you to do is to obviously understand your benefits. But to make sure that you have benefits, you must go into Employee Navigator. You will be emailed approximately 3 p.m. today. You'll get an email from Employee Navigator. It will have all of your instructions on exactly what you need to do. You are required to go into the system and complete the process. It should not take more than 5, maximum 10 minutes. It is very
so Travis, can I jump in real quick?
Yes.
So if someone is electing not to take insurance, do they still need to go into Employee Navigator and waive that?
I believe it is prudent for you to do so, Kim, because as an employer, you're required to offer insurance through the Affordable Care Act, and they should decline and say why they're declining. If they don't, we can just let you know that they didn't enroll in the system, but we would like positive or negative confirmations in an ideal state.
Okay.
Primarily that's for medical, to be honest, but you also don't want to be in a position that somebody says you didn't offer me insurance, even though this is recorded, even though we're emailing everybody, even though we've got, 31 of our closest friends on this phone call today. It just allows us to all be on the same page that everyone was given an opportunity to enroll. Guys, if you have any questions whatsoever, our EBA team, and I'm just going to go ahead and skip to the very end of this guide, just kind of to get right to it. The very last page of this guide is our team at Arista. This is not the insurance company. This is us, advocates for R2T. Enrollment support, helping you understand just general education, having issues with ID cards, explaining your bills. You have kind of a HIPAA secure question you don't want to kind of talk to people internally about because it's health related. That's what our team is here for. It's completely secure, confidential. You can call us at this telephone number right here. You can also email us during those times, and we're here to help you any way that we can. The rest of your service providers, their information is going to be here, the websites, etc. So just want you to be aware that information is here on the very last page. I'm going to get back here into page 4, and then I'm going to turn it over to Angela. This is just what the qualifying life event IRS rules are. It's not something we have to talk about, but this just talks about marriage, divorce, death of a spouse. These are the items that are the exception. So if one of these things happened, let's say 3 months from now, you would have the legal right to go in and change your medical, dental, vision, HSA, elections, etc. To do so. So this is just a little bit about that. And then I'm going to take just kind of guide the process for you and let Angela talk to you a little bit about your 3 medical plans.
Hello, everyone. Good afternoon. We this year still have 3 medical plans, same designs for the first 2. Your HSA, however, has changed just a bit. It's actually a richer plan. The individual deductible is $6,350 with a family deductible of $12,700. The coinsurance is 0% with your plan paying 100%. Your annual out-of-pocket maximum is $6,350, and your family out-of-pocket is $12,700. So this plan pays 100% for all services, including your prescriptions, after your deductible.
So essentially, Angela, once they meet their deductible, there's no more copays. The insurance pays 100% once that 6350 or 12.7 happens.
Right, well, no copays on this plan.
Right.
It's straight 100% after the whole deductible.
Yep.
Yeah.
So there's no plan changes, guys, to the first two plans that you have now. Those still are made available to you. There were no, kind of design changes, if you will. The only thing, as Angela said, that was a positive change was the HSA plan. You used to have the deductible, and then you would also have copays after the deductible for prescriptions or different things. And now, once the deductible is met, insurance pays 100%. So, someone got into an unfortunate car accident or a hospitalization and unfortunately had some large bill. Once that payment is made for the whole 12 months that you have United Healthcare, you don't owe anything else for any other services that you have. This is just kind of an overview of the monthly premiums, but your actual premiums are going to be put into Employee Navigator, and so you'll just see it there.
And this is instructions on how to download the United Healthcare app. I would recommend doing that when you're on the go, maybe even if you're out of your area on vacation and you want to find a provider. This is very easy to get information, help, even get your ID card. It's just a great source. I would recommend downloading it on your phone.
This is always my favorite kind of slide. This is kind of probably the biggest teaching moment, and I'll kind of go off script here a couple times. I think this is the best opportunity to teach you how to make the most valuable choices for your healthcare. And one of the first things you can do is you can go to UHC, find a doctor, which certainly provides you a lot of guidance and counsel on making good decisions. But also just kind of want to teach you a couple of lessons that I've learned over the last 20 plus years of doing this, is what I call kind of the decision tree of support. So you have everything from telemedicine all the way down to emergency room. So really what you're seeing here is the most convenient and the least expensive, all the way down to the most expensive and least convenient. Nobody wants to go to the ER, but COVID has really transformed kind of the healthcare delivery system, and so there's a lot more opportunities for telemedicine. I know I personally have used it several times and have avoided even going anywhere. I've gone to CVS Minute clinics or other clinics in the past because I know getting into primary care doctors or urgent care facilities isn't always the easiest thing, and certainly no one wants to go to the ER. But this just kind of gives you an example, again, of the most convenient, least expensive to the most expensive and least convenient, kind of working its way down and the types of things you could do at each one. But I want to just kind of go off script in here and tell you a couple of stories about how to, use healthcare more effectively. I'll use myself in the first example. So one of the very common things that happen if you get injured is the doctor's going to have you do x-rays or MRIs, depending on the issue, the CT scan. In my case, I have an old soccer injury and I have some knee pain in my right knee. And one of the first things the doctor did is said that you need an MRI, you need to see what's going on. Well, because the healthcare system has changed so much, many of the MRI facilities now are owned by the doctors themselves, or even owned then, because 80% of the doctors now are not independent either. Those are owned by the hospital system. So where I might think I'm going to a Piedmont independent physician, it's actually a Piedmont hospital owned physician who also wants me to go use a Piedmont owned MRI facility because it's right down the hallway or right across the street. Well, what you'll know about your plans is MRIs are subject to your deductible and then coinsurance. And so that deductible is your expense. Well, when I went to go look at that particular care for myself, by using the doctor recommended Piedmont owned, this would be the same thing that applies to Wellstar and many others, by the way, Northside Hospital, et cetera. I would have paid upwards of $2,500 for an MRI. Versus when I decided to use the tools, like in this case, UHC Find a Doctor, then When I went to an independent facility, because I happen to live in the Atlanta metro area, about 8 miles away was an open imaging facility. That cost me less than $500. So exact same thing, going to be read by the same exact doctor, almost done in the same amount of time. There was about 2 days difference. Cost me $2,000 less. So there's two things I want to leave you with as ideas to remember about our healthcare system. One is to slow down. When we don't feel good, we don't make good decisions because we're just in a hurry to get there, to be treated, and leave and move on to the next thing, our kids, our jobs, activities in our life. But it almost always is the most expensive thing that you can do. In the same breath, I also want to point number two is where you go matters. And we talked a little bit about that in this example right here. It does matter where you go get that MRI. It matters where you get telemedicine or you go to the ER. And it is going to have a direct benefit, not only to you as an employee in saving your own money, but if we all do our part as individual, citizens, if you will, of this country and users of the healthcare system, we're driving down claims costs for everybody, thus stabilizing, any kind of future rate increases. Many times people feel hopeless, so there's nothing I can do. And I want you to know that that's not the case. There are tools available to make this easier for you. I've used them myself, and they're better now than they've ever been. The second example I'll give you is kind of a dated version because my daughter's now 13, but it has to do with pharmacy coverage. A lot of us at this point have heard of like GoodRx or OneRx or some of these discount medical programs. Heck, even Amazon's in the business. You can go get generic, prescription from Amazon, and they have their own discount card. Or Mark Cuban, the owner of the Dallas Mavericks, has this program called Cost Plus. There's all these discount programs, and you're not always sure which is the least expensive option. But when you have a $6,350 deductible and an HSA plan, it can make a big difference. So around the age of between 2 and age 3, my daughter was eventually diagnosed with juvenile idiopathic arthritis. That's basically arthritis for a kid. And she couldn't walk and had inflammation in her knee. It's basically the same thing as arthritis for adults, but just in kids. And one of the things they do is they prescribe a medication. I don't need to get into why brand versus generic. I think we all know, and we've all been brainwashed at this point, that generic is the way to go with very few exceptions. Even your own pharmacist and doctors will do the same. But that particular drug is called Mobic, is the brand. Meloxicam is the generic. Well, there's a massive difference in cost just between those two. But I decided to put to the test one of those particular services called GoodRx, which is most well known. And I looked in 3 different locations. I looked in Alpharetta, I looked in Buckhead, and I looked in the south side of town with Walmart, because arguably Walmart's the best purchaser of things kind of in the planet, and they always drive the best deal. But what you'd be surprised at is that the cost of that medication in Buckhead was the least expensive of those 3 Walmarts. That's the first thing that was probably going to blow your mind. The second thing is where you go matters in terms of the location. I had access where we live to a CVS on one corner and a Walgreens on the other. That particular area, the CVS was $30 more expensive than the CVS just across the street. So my question to all of you is, why pay more? But because we get in a hurry and the doctor just says, okay, you need an antibiotic, where's your nearest pharmacy? We don't take a minute to kind of slow down and kind of use some of these tools because we're in a hurry. But if you can take a minute to slow down, I can tell you the CEO of one of our other engineering clients has a few medical conditions themselves and are on multiple medications. And by simply using this tool, saved themselves $250 a month in their medication cost just by using a tool. And this was 2 years ago. The amount of money that's been saved is more the wider savings than it was then. So just kind of 2 things that I would always share with you. Where you go matters, and slow down. If you can do those 2 things and use these UHC tools, I promise you will get more value out of the money that you're spending. One of the changes that we are making, I'm going to kick it back to Angela, is a change in your HSA administrator. So I just wanted, for all of you that are only those of you that are enrolled in the HSA compatible plan would be eligible for this. If you're in the first 2 plans on the left side of the page, again, just for illustration, If you're in this plan or this plan, the first two, you are not eligible for an HSA. This is a IRS available program. But if you are enrolled in the HSA compatible plan, you are eligible for a health savings account. And I am going to kick it over to Angela.
Great. So I'm going to read the blip because I think it's valuable. If you participate in the high deductible health plan, you're eligible to contribute to a tax-advantaged health savings account, also called HSA, which can be used to pay for qualified medical expenses. At the end of the year, the money remains in your HSA where it can grow with tax-deferred investment earnings. If the funds are used to pay for qualified medical expenses, the money will continue to be tax-free. Your HSA belongs to you, just as any savings account you may have. In 2023, your pre-tax contribution limit for employees is $3,850. For family, the limit is $7,750. If you are age 55 or older, you have a catch-up contribution of an additional $1,000. Your employer, R2T, it contributes monthly for employees only $25. And if you have employee spouse, employee child or children or family coverage, they contribute $50 a month towards your HSA. And below you'll see a pretty handy tax savings worksheet there. It does illustrate that you can have substantial opportunity for savings. I did want to point out, I have an extra flyer, some of the things that you can use for your HSA, which not everybody knows about it. I think it's valuable to mention. You use it on doctor's visits, dental care, including extractions, braces, vision care, including contact lenses, prescription sunglasses, even LASIK surgery, prescription medications, as well as certain over-the-counter drugs and medications, chiropractic and acupuncture service, and hearing aids, and even the batteries.
So, I mean, kind of long story short, guys, you have a generous HSA contribution from the employer. Not many of our clients offer employer contributions, and so it's a very generous thing. And once that money is deposited into your account, that's your money forever. Any kind of substantiation is between you and the IRS. It's not something that R2T is going to have oversight of. There's no legal responsibility for them to do so. But I would just tell you, if you just think about some of the things Angela said, you're going to have out-of-pocket expenses. And so the idea is, why not put money into this special bank account, no different than your current bank account? It's just one that's dedicated for medical purposes. It's the only triple savings account available that you can put in pre-tax dollars. It grows pre-tax in terms of interest, and it comes out pre-tax for eligible expenses. It is the only thing the IRS allows that to happen. And so if you're going to incur any kind of expenses, even if it's dental or vision, we really encourage you to consider that. And Angela, were there any things about kind of the transition to UHC that are good to mention on the phone call, or maybe is that a follow-up email?
Yeah, I'm gonna have to dig in and find out, but it looks like it's pretty easy. And
Okay.
Kim was mentioning that the employees do have 30 days to enroll on their own.
In the HSA plan, right? 30 days. And
Yes.
I just wanted to make note that this is only for the high deductible plan. And
Yep.
so a lot of times when people select that plan, because it's you have the less contribution every 2 weeks, I get comments like, oh, it doesn't cover any of our prescriptions. But what R2T has done is provide you with that HSA contribution to help with that. So in some respect, we are helping to close the gap on that high deductible. So just be aware of that if you select that plan.
Just as a point of reference, it's the last plan on the far right-hand side. This is the only plan that is eligible. And again, that's based on IRS rules that the insurance companies, R2T and Arista, have to follow. So it's this last plan. If you're enrolled in these other two plans, you are not eligible for an HSA. So when the information comes out from Angela, the enrollment system that we're talking about today, I want to separate two different things. Enrolling in all of your basic benefits needs to be done by the end of the day, Wednesday by 5 o'clock. Setting up your HSA account, which is a special bank account, is outside of Employee Navigator. Okay, it's a process that you have to follow. separately because Arista, R2T, we don't control that. This is a bank account for you individually and your family. So you have to go through the process. We can't even help you. I mean, we can make the information available. We can tell you what to do, but you actually have to take the proactive steps to follow the process because this isn't, again, a bank account that has certain banking regulations and various things. So if you don't set up the bank account, R2T can't put the money in there for you. So step one is within the first 30 days, you have to set up this separate manual process with the bank. So we're enrolling in benefits in the online system today and tomorrow. And we're going to kind of finalize that process by Wednesday. The HSA, again, enrollment process is separate. I just want to repeat that a few times so we know that they're two different things that occur.
It'll be through United Healthcare. Sorry.
I just have a couple more comments on the HSA because I don't have the HSA. Can you all explain how you spend that money? I mean, do you pay first and then give the receipt, or is there like a credit card or
It's a debit
bank card? It's a debit card. So if I were going to have a procedure at the dentist, I would take the card with me and then just pay it there. Okay. And then the next thing,
with one exception, Kim, with an HSA, you can only spend the money when the money is in the account. Right. So for example, if your dental bill is $500, but there's only $200 in the HSA account, you're only going to have $200 to spend. You have to wait till you're putting more money in it for you to use the rest of the $300.
So monthly contributions, right?
And so this $25, 50 is monthly. Just wanted to make that clear.
That means it's 50 times 12 divided by 26. So you won't see $50 go into your account every payroll period. It will be like $21 or something like that.
And you can decide to, you could write a personal check from, I don't know, Truist Bank for $500 and put it right into your HSA if you wanted to. I mean, the idea is you can put it through payroll deductions so it goes out slowly over time. But if, let's say, for example, you're going to have an important surgery and you want to go ahead and fund that information up front, you can do that. I would just say call our team if it's any kind of special exceptions, and we can make guidance. But yes, you're making contributions from the employer through payroll deductions. So yes, it's not exactly going to be, that amount, as Nadia said. And to Kim's point, your contributions, if you voluntarily want to put more in, that comes out through, the payroll periods that you have as well. Kim, did you have a separate question or statement?
Nope, that's it.
Okay. All right. Speed up just a little bit here. As Angela said, that all these benefits are now going to be through United Healthcare. Technically, I believe, Angela, United Healthcare company called Optum that manages the HSA. Is that right?
Yes, that's correct.
Okay, so if you see the word Optum, that's a United Healthcare owns them. Optum is also, technically speaking, the pharmacy benefit manager that provides your prescription drug coverage through United Healthcare as well, in case you've ever heard that name or seen it before. So the employer, R2T, does pay for $50,000 of basic life insurance at no cost to you. There are a couple of extra value-added benefits that we like to talk about here at the bottom. Any kind of beneficiary services, anytime you're dealing with, a premature, death situation, it causes a lot of instability in the family. There's a lot to do. There's a lot of unexpected things. And so just make sure that your loved ones are aware that this is available to make their life easier. It's something we can also kind of make available to them, but this is just important to, reiterate that message. Also, the travel assistance program, if you're traveling domestically or abroad, any kind of emergency travel related situation, I forgot a prescription and I'm a diabetic and something happened, they can work on, getting that to you. All kinds of emergency response services. You just have to be, up to 90 days of a travel, which is short term, and more than 100 miles away from home or the office. There's a telephone number and kind of the global support team on how you can access, and then there's a unique policy number. One thing with this change, United Healthcare on the voluntary life insurance, moving away from Guardian effective 5/1 to United Healthcare, is an ability for everyone to get additional life insurance. So what that means is you can get between $10,000 to as much as $300,000. In Employee Navigator, you will simply just move a slider from left to right to whatever amount that it is based on your salary. There is a cap at how much you can have, and it'll tell you based on your salary exactly how much it costs you. So you don't have to go here and do a big manual calculation. The math is already done for you in the system. But one of the unique things that everybody gets to do, and I want to make sure everyone hears this, is because this is open enrollment, United Healthcare has decided to do two things. Number one, if you already have insurance, and let's say you have $200,000, nothing changes, okay? You will be what they call grandfathered at whatever the amount is that you currently have now. But let's say, for example, that you don't have any insurance and perhaps something has changed and you really meant to buy more life insurance and you haven't done it. General rule of thumb is you want to have a total of 5 to 10 times your salary. Now, obviously, if you're in your later working years or the very earliest working years where you don't have kids, you need less life insurance. Someone like myself with 2 kids and a wife, I'm going to be on the higher end, traditionally speaking. And so this is just term life insurance that's payroll deducted. Again, it's completely customized based on your age as of May 1st. And you can get up to $80,000 with no medical questions. So it does not matter if you have any pre-existing conditions, any current situation, you can get up to $80,000 with no medical questions. If for whatever reason you want more than that, you do have to fill out an online form that essentially is called evidence of insurability that would allow you to get more. So this is kind of a one-time thing for open enrollment only this year that United Healthcare allows this to be guaranteed issue, meaning no medical questions. For your spouse, it's the same situation. It's just $10,000 or $20,000 and you get the full $20,000 guaranteed. But if you want to buy spouse insurance, you have to have it yourself, and then you can get an equal benefit of either $10,000 or $20,000. But again, it's guaranteed. And then child coverage at $10,000. So that's kind of how that works. And again, everything is calculated in Employee Navigator. You just have to move the slider. It tells you what to do. What I wanted to cover from the disability is to kind of just get rid of that misnomer on calling it disability insurance. It's really income protection. When we talk about our ability to earn a paycheck, if something happens to us at work and we don't have an ability to earn a paycheck, you know, at some point PTO or sick leave goes out, and you know, there's really you can't have a job just protected forever with a paycheck. And so the intention of short-term disability is after a 7-day kind of waiting period for an accident or illness, you would be compensated 60% of your weekly income up to $1,000 a week for up to a total of 26 weeks. It's, you know, 26 minus 7 would be 25 weeks of actual payments. There are no pre-existing conditions for that. And so this makes it a very valuable benefit that if something happens to you, you know, this is taxable wages because it's paid for by the employer, but at least you have some type of income in a moment of need for your family. What essentially happens from short-term to long-term is just what it sounds like, which is, you know, at 26 weeks, when the short-term benefits end on paying you on a weekly basis, it just moves to paying you on a monthly basis for something more substantial. So it just kind of seamlessly goes from one to the next if you're still disabled. So it starts at the 180th day and it goes all the way to Social Security normal retirement age, which is different for me than it is for, you know, for example, you know, my parents that are 72. That'd be a different kind of retirement date. It basically makes a payment based on what's called your own occupation. So if you're an engineer, for example, what your job duties in the general engineering community in your specialty of, let's say, civil, in the first 2 years. After that, it changes to say, you know, based on your prior experience and training, you know, could you potentially do something else? And there is a small pre-existing condition on this, and there's a definition of that there at the bottom. The dental insurance, this goes over the dental benefits, telephone number, how to search for a provider, kind of what the benefits are. You know, really, this is going to very, very closely mimic what you have now. You know, you're going to have a $50 or $150 one-time deductible. It's going to pay up to $1,000 in a given 12-month period of time. And, so long as you go in network for preventive services, the insurance pays 100%. If you go out of network, and unfortunately my dentist is almost always out of network, I always end up with a little bit extra of a bill for like $26 for, fluoride treatment, or the fact that they want to charge a little bit more. And so, but if you go in network, there's an ability to look at your in-network providers. It's the passive PPO network. Anything more serious like basic services, anesthesia, extractions, that's kind of a cost sharing where the insurance pays 80, you pay 20. Again, no more than $1,000 a year in a benefit. And it also includes orthodontia for children up to age 19 of $1,000. Any of you that have done this knows that it's way more than $1,000. But this is intended to be some kind of assistance in that process. If we just fully covered orthodontia bills, those rates wouldn't be $27 a month. That would be more like $50 some a month just in premiums. And so there's a balance between, what the benefits look like and what the costs are. But again, these are just for illustration purposes. These are monthly costs. In the system, it shows what your costs are based on your deductions. Here's a little bit just about the dental network, UHC, the benefits hub, wellness services, benefits on the go. Just a few helpful tools and brochure things that talk about the dental network. The good news is everything's on my UHC. With you having everything with United Healthcare now, you can get a one kind of setup and things are going to be there for you. But same thing as medical, you can select your coverages. You look for dental cost calculators if you want to have an idea what it's going to cost you before you ever get there. There's just a lot to do there. And so there's just, again, more information from United Healthcare on that. Same thing with the vision. It is a slightly different website for their vision because it's done in partnership. But this talks about where to go and the telephone number for UHC. And this goes over the benefits. Again, so long as you stay in network, it's a simple copay for an eye exam. It's a simple copay for prescription glasses, so long as you're in network. And, the rest of these are going to be typically allowances for contact lenses or frames, et cetera. And so there's just a little bit about the dental and vision information. And like before, this goes over all the various retail providers that are in network. These are just kind of the most well-known. But again, you can go to My UHC Vision or the telephone number there to look at maybe your individual practice if you go to someone that's outside a major retailer. Just kind of an extension of those providers here. Some additional information, again, uhccontacts.com, just let you see more information. Again, this is kind of for after the meeting if you want to get a little bit more specific on information. It's there for you. The rest of your benefits will remain with Allstate. So these are essentially supplemental benefits that if you don't feel like you have enough money saved in the bank, if you encountered, copays or deductibles or things that are going to cost you money from your medical plan, that's when you would be interested in some of these benefits. So critical illness is just really there to fill a financial gap due to out-of-pocket expenses. And so it's just going to give you a lump sum of $10,000 or $20,000 if you have one of the designated conditions that are here on the page. So if you have a heart attack, you're in plan 1, it's a $10,000 benefit. If you're in plan 2, it's $20,000. So it's kind of just a scheduled benefit. I would tell you as a basic financial planner, if you have that money, available or could be an emergency fund to fund your deductibles and things, there wouldn't be a real reason to buy this insurance. But if you're not in a position to be able to pre-fund or have that money saved, some people like to have this as kind of a stopgap in case something happens. You also have some wellness benefits. So if you just go get a wellness exam, which costs you nothing under healthcare reform, and you actually submit a claim, you get $100. And so you can technically get some of your premiums back, right there just by doing something, that you need to be doing once a year anyways. This just is a great example. The team included that just, kind of gives you an example of what happened. Someone that's actually had a critical illness themselves, had an EKG, like, kind of what really happened with their situation. And they didn't have to dip into their 401k or an emergency fund. They just used this benefit for that. And so it goes over that. And then it just kind of shows you, the rates here based on either non-tobacco or tobacco user, either Plan 1 or Plan 2. The accident insurance is kind of like you see online with the Aflac duck that we've probably all seen on TV. You know, you slip and fall, something happens with the child, and again, just like critical illness, these are reimbursed expenses to help offset medical expenses. This is, you know, a bit longer of a list because these are accidents typically than they are like a really major you know, kind of condition like a heart attack, stroke, or cancer. But this just gives you an idea of the types of things that it can do. And again, the whole idea is to pay for unreimbursed medical expenses if you have, you know, either on or off the job types of conditions. The cost is down there for you. And then the last one is hospital insurance. Think of this like gap insurance. Again, you guys have had this offered for some time. Hospital insurance basically just replaces a specific condition. So people have different needs. That's why these benefits are offered. And sometimes it can feel a little bit overwhelming. And I imagine some of you might feel that way as an example. But, you know, think of these benefits as hospital indemnity is, you know, really meant for the hospital-based care. A confinement or something very specifically, therefore the premiums are a little less. Accidents are just paying for supplemental health for accidents themselves, and then your critical illness is the same kind of concept, but just major kind of significant expenses. But they're all intended just to supplement what maybe health insurance is not able to. At the end of the day, this is, I don't know which number, Angela, I'm losing track here, but I said I would talk about Employee Navigator at least a few times. And so the one thing everybody must do by the end of the day on Wednesday is to log into Employee Navigator and enroll. Probably while I've been talking, those of you have seen an email that's come out. If you have not provided your email to Nadia, we cannot enroll you. And there were a few missing emails, I believe, that we had. And so we need everyone to make sure that we have your email. If you did not get the email from Employee Navigator, check your junk or check your you know, filtered messages wherever you happen to store those. If you haven't, please call us and let us know. That would tell us whether or not we need to get something back to you. It is very, very, very simple. You're just going to follow exact prompts one after the next. Should not take more than 5 to 10 minutes. Again, you're getting an individual link. It's going to ask you to kind of log in, give yourself a password, and go through the actual process. Just follow the prompts, and if you have any trouble, you know, let our team know. But we've actually even put the print screens here for you. So you know, kind of step by step. If you're a first-time user, you got to click on register a new user. Everybody will have to do that. Everybody is a new user. You're going to basically create your account, your username and password, and go through the steps. You're going to onboard, and you're just going to go through each of the enrollment screens one by one. You're going to go through your benefit elections, if there are any forms which you don't have, and then you're just going to save and confirm at the very end, and then it's going to show us that you were done. We then can track with the leadership team who is actually pending enrollments and who is actually done, and we can provide that report with Nadia and the team just to make sure that everybody is getting through the system okay. If you miss a step, you will see the enrollment not complete. Okay, so it'll say at the very last, can't see it super well here, but it will say in yellow, you know, and what this is over here is like the 4th benefit out of like 10 was not enrolled correctly. That's really what that screen is saying. It will tell you high 5 enrollment complete if everything is done. And so the rest of this document, y'all, is just a bunch of federal notices that you've probably seen in years past. It's stuff, and it is darn near 20-some pages of notices that I am not going to bother you with, but they are notices nonetheless to make an informed decision just about various federal laws and things from COBRA to mental health parity, etc. And again, the very last page of the guide is meant to be just helpful information. If there's anything our team can do, that is the email address or the phone number you would want to call to get assistance. So again, Employee Navigator, you're enrolling between now and end of the day on Wednesday. Your HSA enrollment is only for those of you enrolled in the HSA compatible plan, which is the far right side on the medical page. And you have 30 days to enroll in that. So it will take just a little extra time, but if you have to do your part in order for money to be transferred there for you. So with that, I was going to open it up to any maybe public bravery questions, or Kim, if you or Nadia have any thoughts on things we might need to go back and cover.
You said that we have enrollment until 5 p.m. Wednesday, or is it midnight Wednesday?
Good question.
I believe it's midnight.
All right, I stand corrected, Nadia.
Okay, and then HSA, again, what Travis just said, it doesn't mean you have 30 days to enroll. You still have to enroll by midnight Wednesday, but you have an additional 30 days. Well, excuse me. Then you have, 30 days after Wednesday to enroll in the HSA program, which is very easy. It's just a guide. You enter your information and you're all set up. So everybody who's enrolled in HSA, I will be emailing that guide too. That's it for me.
Nadia, did you get your registration email from Employee Navigator?
Yes, I already went through it, and it's fairly easy. It's similar to Beacon, what you guys have been what you guys have used. It's, just lists all, you go step by step through each plan, you get to select it. I don't know if it does show you your payroll contribution, basically, like right off the bat, with each selection that you make. So that's pretty cool to see. And then you add your dependents and all that stuff. So it's similar to Beacon, basically, what we're used to.
I would, you just made me think of two things. This is an opportunity, y'all. I've been in a really ugly situation when I worked for an insurance company about 18 years ago, where the employee did not put their beneficiaries in the system. The employer is not responsible for your beneficiaries. There's not a legal statute that says they are responsible for putting your beneficiaries. You are responsible for your beneficiaries. So R2T makes available through Employee Navigator an option for you to put primary and or contingent beneficiaries. If one is not listed in the system, I will just tell you that's not a fun process with a family member. When money becomes involved with family, it can get ugly pretty quickly. And so then you're talking about probate court and various things that they're going to decide how everything is going to shake out. So please make sure all of your address information is correct. We do need social security numbers for you, your spouse, and any covered kids if you are enrolling in the medical, dental, or vision. If you are covering a family member for medical, dental, or vision, please, 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 we must have their social. It is the only way that they're going to make sure that everything is covered correctly. You could put a dummy one in and rig the system and get through it. But when you call Nadia or you call Arista saying that your ID card is messed up, I just want it on recording for Nadia's benefit and ours that you need to go back into the system. You can go back into the system today. You could start the enrollment. You could go back before Wednesday and make changes. It's not just a one-time deal. You could go back in and make changes between now and Wednesday. Well, this is a quiet group.
No questions, guys?
I do have a quick question. So just to clarify, this is just the period where it's open to re-enrollment, but in terms of like the deductible period, that is still based on the calendar year, correct?
That's a great question. Yes, it is. All insurance companies use calendar year for deductibles and out of pocket. And because you're not switching medical coverage, United Healthcare will know what you have. So for example, let's say you were in the HSA plan and now you want to move to a copay plan. If you'd already met, let's say, a $3,000 deductible, right? Let's say you met $3,000 deductible and this plan that you went to had $1,500, you would be credited for that for the full calendar year. That's a great question.
And now the inverse would be true as well. Say I was in the middle one that has like the 1,500 single person deductible.
Yes.
I could have already met that if I swapped to the 3,000. I'll still have another 1,500 to cover for the remainder of the year.
That's correct. And then on January 1st of 2024, that's when the reset happens.
Okay.
Great question, James.
I also want to say one more thing. You are not automatically enrolled. Everybody has to go in and make a selection and enroll. Even if you were enrolled last year,
I had a question as well.
I want to just allow Nadia to finish that comment because it was extremely important and we're recording this. Nadia, will you finish that point and I'm going to open it up for the next question?
Yes, I'm just saying no one is automatically enrolled in insurance. You have to go through the process and make your selections. Nobody is enrolled automatically. You have to make your selections before Wednesday at midnight. If you do not, you are not eligible until next year, May 1st. So.
And I didn't catch the name of the next person, but please ask your question.
Whenever I first enrolled, whenever I became employed, I didn't have the option to enroll an employee spouse, even though I'm married. I was wondering, is that something that I had to put in? I was able to make him the beneficiary of the life insurance, but I wasn't able to get spousal coverage for insurance. So what's the process in that situation?
So what you have to do in employment, I can't, I can just tell you what the system is. There was no limitation. As long as you have a legal spouse, you have to first, in Employee Navigator, you have to first add your dependents, which is like the first or the second screen once you get logged in. If you don't enter your spouse as a covered dependent or your child, if that pertains to someone on this call, they will not show up when you enroll in medical, dental, vision, or other benefits because you're not having an option to have them in there. So please make sure that you first fill out your eligible dependents. And then as you go through the enrollment process, you can choose employee only, employee spouse, employee child, family, whatever it is, benefit by benefit. But you must put that information on the front end.
Okay, I misunderstood. I thought of dependent as like a tax dependent.
If this is a legal spouse, in that case, they would be a legal spouse because they're a tax dependent. Your child or spouse, in your case, your question was a spouse. So are you legally married?
Yes.
Okay, then you would just need to make sure you include your husband's name and phone number, if you will, in the system when it asks for dependents. And then when you get to the medical benefit, you can elect employee only, employee spouse, whatever works best for you.
All right, thank you.
You got it.
Travis, what should employees do if they have not received a registration email?
Check your junk folder first, or call our EBA team. I will tell you, Nadia, we did not have emails for all employees, so we can't send an email.
You guys sent me a list and I responded. So
okay. So then that's been updated. Then I know as of before I had an opportunity to join, it didn't have everybody. So if they don't have it, just reach out to, please do not call individual members of the team. Myself, Angela, we can't track things. We like to track things, keep it very organized. If you have questions, and whatever they are, it's 866-370-3119 or help@aristacg.com. We got a team of people, of which Angela is one of the many people that assist that team that are there to work. Just let us know. Let me guess, that's already happened already. That never happens. Anybody else?
Yes, I had a quick question. I guess I wanted to go over the difference in the BTFB plans versus the BTGF plan. Is that just deductible, out of pocket, and copays, or is the actual coverage the same as far as network providers and all that?
Yes. Yeah, it's great. It's a really good question. There's no changes to pre-existing condition. There's no changes as to what what's covered or what's not covered. There's no differences on the network. The only differences are the individual financial differences on the deductible and the co-pays and co-insurance. That's it. Just the stuff that you're seeing here.
Great.
This is not a limited network on one versus another, but that's a good question. You'll notice it says right here, designated network provider. That's basically talking about in-network. If you essentially type that thing into your search bar on United Healthcare's website, it'll go through Choice Plus.
Perfect. Thank you.
But if you're uncertain, and I didn't catch your name, it might have been Tyler. I would
Yes.
encourage, if you're in one of those two plans now, unless your doctor's decided to not be in network, there shouldn't be any changes. But anytime there's a question, always go on to the doctor finder for UHC or get into the app. I only use the app. I don't even carry an ID card anymore, guys. There's no need to carry an ID card. Doctors can just look you up in their system. And so, but yeah, everything you need, you can get your ID card right there, right on the app. That's the best thing for all of you to do. If you aren't currently covered, have never had medical coverage or dental coverage or vision coverage, and you're getting it for the first time, it is going to take us, guys, a little bit of time administratively to get these plans set up. So if you've never had insurance before, or you're adding someone for the first time and you go to the doctor on May 1st, you're probably going to end up calling us because they might not be able to verify your benefits. It's going to take them about the full first week on United Healthcare's end just to kind of get everything cleaned up. If you're already covered in a medical plan, for example, and it's the same plan as you had before, you're already going to be in the system.
I had a question. It's not a new question. Actually, it's the same question as Jimmy's, but I think we kind of hit the answer really quickly, and I wasn't sure if I understood there about when the deductibles change. So for instance, if I had like a $4,000 deductible this last year and I hit that already, and then I switched to the HSA plan that has a $6,000 deductible, I now have more to pay this year before I hit the deductible again.
That's correct. Right at the very top, deductibles and out-of-pocket maximums run on a calendar year. So these three plans are your three medical plans available to you, and the corresponding deductibles or coinsurance levels that start May 1st. But if you moved from the $3,000 plan to the $6,350 plan, you would have $3,350 of additional expenses as an individual to cover between now and December 31st, or I should say between May 1st and December 31st.
All right, thank you.
Yep. By the way, that every employer, with very, very few exceptions, we have no clients. Everybody operates this way. Even though your plan might have a 5/1 effective date or a client might have a 9/1 effective date for changes, it's always a calendar year basis for how the deductible and out-of-pocket works. Anybody else? Now our team will make sure this video gets downloaded and into a video file, and then we can make that available to you, and then you can share that with the team.
Okay, thank you very much.
All right, guys, have a great day. Take care.
Thank you.
Thank you.
Thank you.
Okay,
See ya.
thanks.